Ladies and gentlemen, it's a great privilege for me to introduce our new expert here who just joined us, Dr. N. Khanna, who is the Senior Interventional Cardiologist and the Coordinator of Cardiology, Cath Lab and Vascular Services at Indraprastha Hospital, Apollo Hospital in Delhi. Welcome, sir. Now I request Dr. Manchanda, who is here with us, who is a very eminent person. I call him as a guru of yoga. I don't know whether he believes my statement or not, but he is a guru. And he, as a person who did a lot of work on the mind intervention, he believes that most of the problems are caused by ourselves, by our choice making. Let's see what Dr. Manchanda has to say, the role of mind in the prevention of heart attacks and creating a healthy heart, including yoga. Dr. Manchanda, sir.
Thank you. Well, as you heard, there are several risk factors for heart disease. Psychosocial stress is one of them, and this has been a neglected factor for a long period of time. You also heard that there has been a lot of advancement in the awareness about the heart attack. People are aware that they have to do exercise, they have to avoid tobacco, they have to take proper food, etc. But in spite of all the advances like angioplasty, bypass surgery, even heart transplants, the heart disease is increasing. Have we ever introspected? Well, I think one of the simple explanation is it is a lifestyle related disease. We all know that these are lifestyle related diseases. What is lifestyle? Lifestyle means the behavior of an individual in which the mind interacts quite a lot. For example, it's a mind-body interaction. Mind creates thoughts. If my thought is not to do exercise, I will not do it. I ask some of my patients who are very well educated, why don't you exercise? He says, doctor, I get up in the morning, I want to go for a walk, but my mind says, don't go today, go tomorrow. And tomorrow another excuse is there. I go to a party and my mind says, have this bad food, but don't have tomorrow. Tomorrow is another excuse. So it is the weakness of the mind which is causing it. Even one of my patients who knows so much about smoking, he says, my mind says 1 or 2 cigarettes does not matter. And then he doesn't know where this really ends and all that. So mind has a very strong effect on the heart, and this is called mind-heart relationship. As you know, as is the mind, so is the body, and for a long time we know that if healthy mind has a healthy body and a healthy body. So I think we have failed in tackling this problem because we have forgotten the relationship of mind. And the mind can be stabilized by our ancient technique called yoga. Yoga is not a few asanas only, it's a complete way of life in which we remain physically, mentally, emotionally and spiritually healthy. For example, diet is a part of yoga, sattvic diet, which you heard about. That's a way to prevent heart disease. Not taking tobacco is also a part of yoga. Then stress management is a very important part of yoga. And the most important thing is that the mind becomes strong. For example, I have been treating patients with yoga and even young people, and these people have their mind strong. So when they want to exercise, they'll get up in the morning. If the mind says, don't go today, they will say, you shut up, I will go it. And the mind has to be strong. And it has a lot of studies are there that yoga can prevent heart disease. All the risk factors that you heard, high blood pressure, for example, large number of more than 1,000 studies are there that blood pressure can be significantly lowered, diabetes can be lowered, psychosocial stress can be lowered, smoking can be stopped with this. There are a lot of studies for this, and even the cholesterol could be affected. And there's a lot of data now accumulating, especially in the animals, that these risk factors like anger, ego, hostility, jealousy, they can cause heart attack. You must have heard of some people suddenly getting angry and they get a heart attack and all that thing. And a lot of studies are there which shows that these psychosocial factors, even poor socioeconomic status, even a bad neighborhood, etc., even the pollution you heard, not only the pollution of the air, but even a sound pollution. There's a big study which came, people staying next to the highways. So stress is a big factor, and this stress can be controlled by yoga, and that is a mind-body relationship. And therefore, I suggest that all people should be doing yoga. There are some studies to show that people who are happy, this means they are doing yoga, because the ultimate aim of yoga is to keep you happy and stress-free. People who are happy, they have less heart attacks. People who are under stress, large number of studies are there. stressful jobs, they get this heart disease. And in the animals it has been shown, even if you give very low fat diet and produce anger in them, they get heart disease. On the other hand, you give very high cholesterol diet and the animals are given some compassion, love, and the heart disease can be prevented. So the role of these emotions in the heart disease is still to come, but there are a large number of clinical observations that these bad emotions can also cause this heart disease. So I believe that the mind has a strong relationship with the causation of the heart disease, and if we can control the mind, which we can by our ancient technique of yoga, the heart disease could significantly decrease. And there are studies not only before heart attack, even after heart attack. A large paper was presented recently in the American Heart Association in Chicago, in which more than 4,000 people who had heart attack and angioplasty, when they were trained in yoga, they had a better outcome than those people who did not have yoga. So yoga has a tremendous potentiality. It started in our country, and I think we should be following in our patients.
I think Professor Manchanda has given a very clear message. Heart attack is born in the mind, manifest in the heart. Very important message. If you conceive the thoughts, perceptions, interpretations, experiences, and choices of toxicity, you will get a premature heart attack. And he also mentioned, if you get the perception, conception, and thoughts and interpretations of love and compassion and humility, you will get a healthy heart. Very beautiful expression, sir. I think you mentioned that just 1 fit of anger can produce a massive heart attack and even a sudden death. And you and me as a human being have only 2 emotions. One is the emotion of fear. It is from fear originates jealousy, hatredness, anger, hostility, cynical behavior. And then we have vengeance, vindictiveness, suppression, frustration, depression, repression. Everything is an offshoot of fear. And on the contrary, Dr. Manchanda has mentioned that you must have a perfect mindset. If you have a perfect mindset, you are going to nurture 60 trillions of your cells with 60 trillion chemical reactions occurring every day in the body with love, compassion, altruism, and empathy and sympathy, and you will be in the parasympathetic mode all the time. A very beautiful message. You should not be in a sympathetic mode, in an aggressive mode, all the time vulnerable. You have to be non-vulnerable from childhood to remain non-vulnerable till the age of 80. After 80 is a God's will. We all have to go. We are not permanent in this universe. I think that's a very important message. And his message is very clear that mind and heart has a very strong connection. That's a very important message. Thank you, sir. I think it was a very, very nice expression. We have with us Dr. N. Khanna. He does a lot of intervention. Dr. Khanna, I have just a very important question to you. You do a lot of coronary intervention, peripheral vascular intervention, carotid interventions. What's your impression in your practice today when you see heart attack patients? Are they young, or they are old, or they are same what you were seeing 20 years ago? Or you find there's a difference in the practice today? Dr. Khanna, sir.
If you see patients in my last 25 years of practice, not only that earlier we were seeing patients who are younger than their Western counterparts, but now the age has really come down to late teens, 19, 20, 21, and it goes up to 35. In fact, we analyzed the data in our hospital for last 2 years. We found that 20% of the patients are below 30 years of age who come with acute heart attack. And many of these patients, when we see their coronary arteries on angiogram, they do not have multiple blockages in multiple arteries. It's only one plug which has ruptured and created a devastating effect on the heart, and the heart is really weak and they suffer throughout their life or they die because of it. And I'll come back to this. The risk factors would usually are smoking, a very poor lifestyle which they have adapted, gone back from our Indian way of lifestyle to a Western style. And what Dr. Manchanda said, the stress, extreme competitiveness, lack of sleep, and jealousy, negative emotions, those are usually the trigger points for acute heart attack in young people. and these are they create a devastating effect. So this is one thing which is very peculiar in our country, which we are seeing as a trend, and therefore the focus should be to reverse this or to prevent this. And what is required is sort of a proper conditioning of the mind, proper habits, in terms of exercise, in terms of yoga, in terms of taking control of their diet, and also checking their lipids. That's another thing which has come up recently, that they have very bad lipid profile. Their good cholesterol is really low, the bad cholesterol is high, and these patients are usually sedentary. They are not very active people. So this is one reason of acute heart attacks in young people. The other group, which is very surprising, which is coming of late now, is young enthusiasts who gym a lot. They take all sort of hormones and testosterone boosters. They have very artificial lifestyles, and they are into muscle building abnormally. These patients also tend to come to us with acute heart attacks while gymming or while having a very aggressive lifestyle. So these are the two things which we have found in recent studies.
So I think our three experts, including Dr. Manchanda, Ravi Kasliwal and N. Khanna, are of the same opinion. And their opinion is very straight, that all youngsters are very enthusiastic, highly ambitious, and have a negative competition. And that's how they fall victim to oxidative stress and fall victim to a heart attack. I think Ravi has also mentioned that stress scoring is very important in preventive health programs. So I think a time has come, we have to create so-called happiness classes in the schools. I think Delhi government has already started this kind of program. So I think in winter, it is seen that there is a little peak and increase in the heart attacks, because there is a tendency for clotting more as compared to summer. And hypertension also is very, very common in the winter. The stroke rate, even I have seen a lot of sudden deaths more common in winter.